Okay, so taking the heart rate, did you have any problems? What are some of the problems you might have with a client that's maybe not in good shape? Sometimes it's hard to find. Okay, maybe they got a lot of subcutaneous fat, right? And it might be you might have to put a little more pressure on there to find it. Some people, if you noticed when you were taking blood, the heart rate, some people it's located a little higher up. Some people it's down closer down to their hands. So you got to look around for it and find it, right? But it's in there somewhere. Okay, so what are you going to do with that information? Okay, now you found their pulse. What are you going to do with the information you got? Okay, well, what you're looking for is beats per minute. How many times do you feel that pulse per minute? Because that tells you how many times the heart's beating per minute to get the oxygen out to the cells. So beats per minute, do you have to count it for a whole minute? Yes or no? Yes. Okay, if you wanted to get a really accurate one, you would count every beat for an entire minute. Okay, is there a way that you could take a shortcut?
Yes, you could do 30 seconds.
Okay, and then what? You'd say beats, will you say beats per 30 seconds? Or would you do something else? Multiply by 2, right? So you could take it for 30 seconds and multiply by 2. You could take it for 15 seconds and multiply by 4. You could take it for 10 seconds and multiply by 6. Okay, those are all factors of 60, right? So you 60 seconds in a minute, right? So you could say, okay, I did it for 15 seconds, and I'm going to multiply by 4. 15 times 4 is 60, so then you get the beats per minute. You could even take it for 6 seconds, which is 1/10 of 60, and add a 0, right? So if I took my pulse and I got 10 beats in 6 seconds, then I'd say, okay, 100 beats per minute. Okay, now normally I would take it for at least 10 seconds. Okay, so just make sure you know how to multiply by 6 and you'll be good. But there are cases where you do have to take it for an entire minute. And one case where you'll find that's true, and we're going to be doing that in our next session, is when you do a recovery heart rate. A recovery heart rate is different than a post-exercise heart rate. If you've ever been to a group exercise class where they say, okay, everybody find your pulse and take your pulse, they usually do that for 10 seconds and multiply by 6, or they do it for 6 seconds and add a 0 to get your beats per minute because 6 is 1/10 of 60. And that's a post-exercise heart rate. Or it's an exercise heart rate, so taking the pulse while they're exercising. A recovery heart rate takes the pulse for an entire 60 seconds to see how many times it beats in a minute as your heart rate starts to come down. And you're going to be using a recovery heart rate in the YMCA 3-minute step test. So the recovery heart rate is different from post-exercise heart rate or an exercise heart rate because you really want to see it come down over that 60 seconds as opposed to just see how high it got. Right? You understand the difference between exercise heart rate and recovery heart rate? Okay, so with the fitness assessment you're going to do, when we do the YMCA 3-minute step test, you're going to have to count every beat for an entire 60 seconds. And that's going to be your baseline to compare them to next time you do it. All right, so anybody have any other questions about assessing blood pressure or heart rate? Okay, and that heart rate information, like we said, you can use it maybe to calculate what their target heart rate range is. You can use it as a baseline, because if you're going to be doing cardiovascular training with that person, if their resting heart rate, let's say it was 70 the first time you took it, hopefully after you've been doing some cardio with them for a few weeks and you go to assess them again when you take their resting heart rate, hopefully that'll come down. So you always want to record these baseline markers the first time you take their blood pressure, the first time you take your resting heart rate. You're going to compare their progress against those markers. And the same thing with the assessments that we're going to learn to do next week is you want to be able to use that as a baseline to compare their progress against. Okay, and that's really a valuable tool for you as you're going along, keeping your client motivated. Can say, okay, this was your resting heart rate when you started, now look where it is. This was your blood pressure when you started, let's look where it is now. This was your score on your YMCA 3-minute step test, Now this is your score. So it helps to keep your client motivated. It helps to keep them accountable. Maybe they're not making any progress, and you go to test them, and sure enough, the test is not indicating that they've improved. So then you can use that to motivate them in the other way. Say, hey, you need to step up your game because you're not getting the kind of results that we expected you to get. Okay, Angela, do you have a question?
Definitely. What is the easy way to heart rate and blood pressure if I'm conducting a class of people?
Okay, so you're saying if you wanted to get a heart rate on a group of people,
Yes.
what's the best way to do it? Well, blood pressure is something you just have to sit them down with a cuff and do it. But the heart rate, if you wanted to just get a post-exercise heart rate, or let's say maybe you're teaching a yoga class and you just want to see what their heart rate is before and after class, which would be, good to see if it actually calmed them down after they came in from their stressful day. You might want to take a heart rate at the beginning of class after they just got out of the car and they change it in their clothes and getting ready for class start, and see if at the end of class, do it again. See if it went down. See if it actually had a positive effect on lowering their heart rate. So how would you do that? Normally, if in that situation, I would first make sure everybody knew how to take their heart rate. And then I would have them do their own. Or you could put them with partners and have them take one another's. That would be another way to do it. I'd probably just have them do their own and have them either take it here, or I might have them take it at the carotid artery, whichever one they could find. And then I would say, okay, get ready, count, and I would time it. So I would time it. I would probably time it for 10 seconds and have them multiply by 6, or maybe 15 seconds and multiply by 4. So I'd say, okay, get ready, count, and then I'd say, stop. And then they would take that number and they would calculate it themselves. Okay? Any other questions before we move on about heart rate or blood pressure? Okay.